Yesterday, I posted a question on my YouTube channel, Secrets of Health TV, where I asked the question, what topic should I treat, going forward? And I have received, several comments where people are suggesting, different topics for me to treat it. And one of the topic someone just wrote to me is that I should talk about the difference between premature ejaculation and then erectile dysfunction in men. And so I decided to, speak about it. That is why I am shooting today's video. If you want to know the difference between premature ejaculation and then erectile dysfunction, so you can see his question on your screen. And I think this question is a very good one, and I think the time has come for me to, talk about it. And he didn't stop there. He said that if possible, I should, come out with a possible solution. And that is even the more reason why I am shooting this video, in this environment, as you can see, in this small little backyard, plantain or banana farm. Most people don't know the difference between erectile dysfunction and then premature ejaculation. Why am I saying this? Someone will just call me, doctor, I am suffering from erectile dysfunction. Then I say, hey, are you sure? He say, yes, I can perform. Then I will ask the person, are you able to erect? Is your joystick able to, erect? Then the person will say, yes, but within 2 seconds I am done. Then I'll say, oh, this is not erectile dysfunction, but rather this is PE. This is premature ejaculation, because we have ED and then PE. So this is rather PE, not ED. So I think the question is very, very legitimate, and this is the difference. When we talk of premature ejaculation or PE is a condition or a situation whereby the man, ejaculates, or the man will get tired so easily on the field anytime the football match is ongoing. The man does not have the tenacity, the man does not have the power, the agility to continue playing. So within 2 seconds, you realize that the whole thing has come to an end. You understand? And this condition is giving a lot of, or is creating a lot of confusion and a lot of misunderstandings in the various, relationships. So that is the brief explanation of PE. Okay. And then when we talk of ED is a situation whereby the joystick or the man's bola cannot even stand up. It cannot even erect. It cannot even stand up. Not to even speak of entering the pitch to play. So it is a condition whereby the man cannot even lace his boots on and then go and play. So that is the difference. And not only that, sometimes the bola or the joystick can come up or can erect a bit, but not as strong as it's supposed to be. So when a man is passing through this condition, we can term that as ED. I hope you understand. Now, what are the causes, or what causes these two conditions? There are several factors that can lead to, some of these two conditions. Let's talk about, or let's begin with that of PE, which is premature, blah blah blah. The PE can be caused by, abstinence from the match, from playing the match for a very long time. If as a man, you abstain yourself from playing the match for a very long time, you are likely to suffer from PE, on the first time you are meeting or you are playing the match in so many months. Let me give you a typical example. For instance, you are a man, and let's say I'm in Ghana, so let me use Ghana as an example. Let's say you are the man, you are in the USA, you are in the United States of America, and then your wife is here in Ghana. and you've traveled, and left your wife for the past 2 years. For the past 2-3 years, you have been away. And for the past 2-3 years, you have been so faithful. I know some men, you have been so faithful to the extent that you did not cheat on your wife. You were able to abstain from it for the past 2-3 years you have been away. So you see, at that material moment, at that juncture, you are anxious, to come and meet your wife for the first time in 3 years. So when you come back, or when you arrive in Ghana and you decide to go close to the football match for the first time in, let's say, 3 years, that one, there is no way you will last more than 1 minute. It is a fact. There is no way you will last more than even 1 minute, because you have been away for a very long time and you have abstained yourself from playing the match for a very long time. So there is no way you can satisfy your lady. I hope you understand. So at that material moment, at that juncture, there is no way you can do that. I hope you understand. So that is cause or factor number 1. Factor number 2, you can suffer from PE, which is premature blah blah blah, as a result of infectious diseases such as gonorrhea, syphilis, chlamydia, and the rest. All the infectious diseases. If you are a man and you are suffering from that, you are likely to suffer from that. Okay. And then factor number 4 or number 3, diabetes can cause it, especially if you are on a specific or a particular diabetic medication. You can suffer from it. High blood pressure, you can suffer from it. You understand? Depression, and so on and so forth. So these are some of the factors that can lead a man to suffer from PE. Now, let's come back to factors that can make a man to suffer from ED, which is erectile dysfunction. The factors are almost similar. The same factors that can cause a man to suffer from PE are likely to also affect the man from suffering from what? ED. You understand? Because when a man is suffering from ED, it means the man has not been able to tackle the PE issue, correctly. Because if you are having PE issue and you don't tackle it, you don't treat it, you don't, do anything about it, it can escalate into ED. It can escalate you to suffer from what? From ED. I hope you understand. So, in few cases that you realize that some people will suffer from ED without having, or without going through PE. And such cases are maybe accident. Let me give you a typical example. You can suffer from, an abrupt, ED, erectile dysfunction, when you are having spinal issues through accident. When a man suffers, a serious spine accident, such a man is likely to, suffer from ED. I hope you understand. That is factor number 1. Factor number 2 that can cause ED without necessarily, passing through PE is, stroke, paralysis, stroke. A lot of people normally think that when stroke, affect a person, it is just the movement of the legs, it's just the movement of the hands and all that. That is what people normally think about stroke when you talk of stroke. But I can tell you on authority that you may be very healthy, you may look very healthy, your hands, your leg, everything may be perfect, you may be walking perfect. Meanwhile, you have suffered from stroke, meaning stroke of the what? Of the joystick. Stroke of the what? Of the joystick. Your hand, your legs, every part of your body may be working correctly, but you are still going to be called a stroke patient. Why? Because it is rather your what? Your joystick or your bola which has been suffered or which has been hit by the what? By the stroke. So these are the 2 major factors that can cause ED without necessarily, passing through PE. But quite apart from these two, calls, most of the ED issues are as a result of lack of management of PE. It's as a result of PE, so to speak. So if you're having PE and you don't do anything about it, amicably, automatically it is going to cause you, big time. It is going to lead to so many issues regarding, these, complications or these conditions. So this is the difference between ED and then PE. And I've just told you the causes. I'm going to leave it here. In my next video, I am going to suggest to you a very powerful, herbal medicine which you can use in order to tackle the issue of either PE or PD. And let me give you a gist. You see this plant behind me? That is why I told you earlier that it is because of the medicine. That is why I decided to shoot this video here. In my next video, I am going to introduce you to this together with other herbs you can put together to treat yourself from either PE or ED within 3 good months. So don't forget or don't miss that video. Watch this video to the end and share this video, like it, and leave your comment under the comment section. And once again, if you want me to discuss any other topics, you have all the right to put it at the comment area. I'm going to look at it and then work on it accordingly. Thank you very much for watching. Kindly subscribe to the channel if you haven't done so, and click onto the notification bell. Select all so that anytime we come your way with videos such as this one, you'll be the very first person to get notified. And until I see you again in the next video where I'll be talking to you about this, have a nice day and take good care of yourself. I am out of here. Bye bye.